pretty well. Alrighty, dive back into it. Alright, so importance. Prevent spread, contaminated items must be handled appropriately, remove casualty ASAP, and then must not compromise medical condition. So, everyone understands that? Must not compromise medical condition. Pretty self-explanatory. Alright, dispositions. So, location. This is when you're setting up your casualty collection point. 75 meters downwind of MTF or leeward side of a float position with contaminant waste dump. So leeward essentially means away from the wind, right? Wind's not blowing in the direction. Does that make sense? All contaminated items except impermeable chemical protective overgarments and rubber gloves go to waste dump. Why is that?
You said impermeable?
Yes, they don't.
Because you can clean them, right?
You can clean them, yes. Plastic bags and airtight containers should be used to prevent spread of toxic vapors. Dump will be clearly marked with standard chemical contamination markers. So do you guys know what the markers are for chemical? Triangle, yellow triangle with red letters. For bio, it would be a blue triangle with red letters. And then for any radioactive stuff, it'll be a white triangle with the radioactive symbol in the middle, or atom, as such. Anybody need this slide any longer? All right, so disposition continue, no emission or movement with items known to be contaminated. Medical officers should notify authorities of the existence of the dump, exact location, size of the dump, and the type of chemical contamination. This topic is pretty sweet and to the point, very succinct. Inventory number of contaminated blankets. Disposable foil blankets may be used. Requisition new ones or purchase new ones through normal channels if possible. And if replacement not possible, decon by immersing in 100 degrees Fahrenheit soapy water for 1 hour with light agitation. 5% sodium carbonate solution for G agents. Right, so all personnel treat contaminated casualties and equipment must be in MOP 4. So you guys go over the different MOP levels.
You're going to be going over it on the chapter 23 pretty soon, Chief.
Chem protective ensemble is not removed until danger has been eliminated. And then joint service lightweight integrated suit technology may be worn for 24 hours after contamination. Uncontaminated suit may be worn for 45 days.
That last bullet point has been on the test before, so know your wear time.
So contaminated 24 hours, uncontaminated 45 days.
I guess it's on this one.
Like touching this stuff.
Yep, so if it's actually touching the agent, 24. If not at all, and it's uncontaminated, 45 days.
So, MOP. How many MOP levels are there? Yes, there are 6. We're only going to go over 5. So we're going to go over 0 through, so the 6 MOP levels are MOP ready, MOP 0, and 1 through 4. All right, what's MOP 0?
Yeah, that's anything.
You just need to fill the tire, you wear your gas mask. It's on your person, you have all your gear with you. MOP level 1. No.
Everything's available.
So there's an easy. Go ahead. I was gonna say there's an easy way that I do it to remember it. I think of putting clothes on in the morning, right? So your MOP level 1 is you're gonna have your overgarment on, right? So after I put my blouse on, right, Mop level 2, I'm then throwing on my boots, right? So then overgarment and boots. Mop level 3, I'm then gonna put on the mask, right? This is gonna be my next piece, right? And then on mop level 4, I'm now gonna have the gloves on, right? So overgarment, boots, mask, gloves. So think of getting ready in the morning and help you remember that sequence.
Also, hood goes on top of it. Oh, as such. So like I said, you got on your regular field attire. Mop 1, you have on your overgarments. Mop 2, you have your overgarments on with your boots. Mop 3, you have your mask, hood on, and then mop 4, finally gloves. Think about dexterity, right? As you're going through, like we're putting on your hand, you want to do your hands last. You're at that level because what? You need your hands to do things. Once you put those gloves on, you have limited to no dexterity. Everyone knows what dexterity is, right? Like you're such a touch. Right, so air, land, naval ops place for this position. Place in closed basket bag and segregated. If impermeable protective equipment can't be decontaminated, discard and contaminated waste dump. Shipboard ops, double bag suits. So everyone's touched at some point in their life those hazmat bags. They're pretty thick. So you want to make sure you double bag those. Stored outside for transfer to shore facility hazmat team or shore-based preparedness hazmat team.
Put a star next to the thickness because they like to talk about the thickness of the bags.
Am I going too fast? Alright, so impermeable protective clothing, aprons, gloves, boots. So you're neutralize liquid contaminants. Slurry mix for decon, 1:5 ratio. So for 1 gallon of hot water to 5 pounds of supertropical bleach. Aeration for light or vapor contamination. Air outdoors in wind and sun for several days. Water immerse items in hot soapy water for 1 hour. Move, rinse, drain, and hang dry. And then slurry impregnate items by spraying or applying slurry immediately after decon. Rinse after a few minutes can be done while wearing the clothing. Alright, so protective masks, webs, canvas, and leather equipment. Wash external parts with hot soapy water and rinse. Decontaminate with SDK. Carriers that are lightly contaminated by vapor may be decontaminated with sun and wind. Why is it? I think SEK because we went away from using the iodine solution.
I'm trying to remember what that is. I can look it up real quick.
So typically it was done, well before it was done with iodine solution, but as we know a lot of people have allergies to iodine, is why I converted it to SDK, but I can't remember what those initials stand for off top.
Something, I think it's skin decontamination kit, if I'm not mistaken. SDK.
Carriers that are lightly contaminated by vapor may be decontaminated with sun and wind. Wet canvas, boil in water for 1 hour, adding soap to speed up the process. Rinse, air dry, return to service. Bleach and slurry may be also used.
So, sorry, I was going to tell you because I've just noticed it with the acronym. I think it's always confused me. There's 2 different types of decon kits. You got your own individual skin decontamination kit, and then you have your other decon kit that would be for your equipment and supplies, right? So know the difference between the 2. The skin decontamination kit will have that RSDL that we talked about in there.
So for leather, coming immediately with your, or ASAP as soon as possible with your 25 decon kit individual equipment. Through thorough decon by soaking in water heated to 122, 131 degrees Fahrenheit for 4 to 6 hours, then air dry.
So what's in the kit?
I'm looking that up right now for you guys. I know for a fact in one of the kits is going to be the RSDL. You're not waiting on me, are you? No, I'm gonna get with you guys afterwards on that one.
Alright, moving on. Alright, so litter decon. So you have decontaminators with 5% hypochlorite solution. It's on the side surface of litter poles, handles, less than for 10-15 minutes, rinse. If 5% hypochlorite is unavailable, remove gross contaminants. Use N9-295 decon kit. Remove patient from area when decontaminating. Decon litters that can be broken down with copious amounts of hot, soapy water, aerate outdoors until dry and discard. Canvas litters, take apart, decon canvas in boiling water for 1 hour, and if possible, add 4 pounds of washing soda to each 10-gallon rinse. Wood 30% aqueous slurry bleach, and let sit for 12 to 24 hours. Repeat as necessary, swab dry, and aerate at elevated temps if possible. Metal unpainted, soap and water, or decon solution. So everyone here ever been to a ship?
Yeah.
Alright, so onboard vessel, for those of you who haven't, and a lot of the industries, say for like your DDGs or maybe some of your larger decks, before you go into medical, when you're coming in from the water decks, they have decon stations there. So in the event you are in a CBR event and you'll need to get contaminated, then there's essentially chambers that they go to the process to get cleaned as they enter into the ship, while the ship's chemical defense system is working and make sure aerating, keeping all those toxins and contaminants out of the ship, the interior of the ship. Right, so verify residual hazards may emerge as chemical vapors. Monitor decontaminated equipment. Use an ICAM to check items prior to using it if time allows. Do the following. Place individual items in separate plastic bags and seal. Place in sun for 30 minutes and recheck using ICAM. If residual contamination is found, bury items unless it is essential. If it is essential, repeat above step and recheck the ICAM. Alright, that is it for that PowerPoint. Any questions on that? The slide is a little bit long. A few minutes before we go into it, I keep pushing. Push. Silence is consent. Alright. Alright. So medical aspects of chemical, biological, and radiological warfare. Chemical agents. So history. First large-scale use of chemical agents was 1915 World War I. Germany used chlorine gas, approximately 5,000 casualties. 1/3 of all casualties in the conflict were due to chemical agents. Iran used mustard gas in 1984, and terrorist groups used sarin gas in Tokyo subway, which produced 5,000 casualties. So, has anyone ever heard about this incident? So there was a man who worked at a facility and was a part of this organization or group. They all have these very, with any of these groups, very charismatic leaders. So it was essentially a series of them. They went through and they took one story they followed in particular is a gentleman. He sat on a train and with his umbrella he had it wrapped in a newspaper. So when he got to his exit, before he entered his exit, he put the newspaper down, essentially shattered the vial, and then exited the train. And within a few moments, people started feeling sick, ill throughout the train. Before long, it just went bananas. And there were multiple incidents where, in these various subway stations, where people died, especially those who were in very close proximity to that sarin gas exposure. So it's a lot more in depth. That's just kind of like the wave tops of one of the individuals who were involved in that event. But very, very interesting story to read on how they had this interesting network of people and how they brought it down. Overview. Chemical weapons are defined as any chemical weapon through which a chemical action on life process can cause death, temporary incapacitation, or permanent harm to humans. or animals. It can be dispersed by several methods, aircraft, munitions, commercial sprayers, smoke generators, chemical agents enter the body via respiratory and through the skin. So classes of agents: non-lethal, lethal, persistent, non-persistent. And we'll go into a little detail those as we go through. All right, so names, classes. Note the classes. So for blood, blister, nerve, riot, and pulmonary agents. Pause here so no people are writing things down. You're gonna distribute all these PowerPoints too, right?
Yeah, they have them too.
Alright, we're good on this slide? Alright, so detection equipment methods. So you have your M9, M8 chemical detection paper. M9 is most widely used, and it's primarily for nerve blister agents. So M9, nerve blister agents, turns pink, red, brown to purple.
I want you to pay attention to the word that it says indicates the presence, meaning it's going to tell you the agent's there. It is not going to be able to fully identify what specific agent it is, but just to tell you that there's an agent somewhere around.
M8 used to test presence of liquid chemical agents. So yellow for gold for G class, olive for VX, and then red for purple blister agents.
So, sorry. I was going to tell you guys a way to remember it for the classes. So for yellow, gold, another shade of yellow is gold, which is going to be correlating with G class. What's the Spanish word for green? Verde. So VX, verde, is going to associate with your olive green. And then red, purple, I just think of the color of what blisters might look like on the skin. So that is red, purple for blister agents.
All right, and then lastly, you have your.
So, can you go back one slide?
Good.
Yes.
You have your M256 Alpha 1 chemical agent detector kit. So it detects nerve gas, mustard gas, cyanide. Contains M8 paper, instructions, a vapor sampler, 12 enzymatic tickets that contain laboratory filter paper for detecting chemical vapors, and the reaction on the paper that detects chemicals takes about 15 minutes.
So the reason why I said what I said, right, is because we need to know which paper is included in the decon kit, or the chemical detector kit, sorry. So your M8 paper is in that kit because it actually detects specific agents, right? Since it can list and tell you exactly what G, VX, and blister agents are there, it's included in that detector kit. And then the M9 would just be, I think, the tapes around your wrists and ankles to detect that an agent is in the area.
All right, so PPE, your personal protection. Joint lightweight integrated suit. So it has your field mask with hood, gloves, boots, and then MOC levels. So MOC level 0 through 4, we know over that already. Your M291 skin decon kit. You need to do it within a minute. Detailed use is in that minute P50, PTAC 5041. All right, so chemical agents, nerve. So you have your VX, GA, GB, GD, GF. So greatest concern, produce effects by interfering with transmission of nerve impulses in the parasympathetic nervous system. So they react with cholinesterase, chemical in the body that catalyzes neurotransmission. So as I understand this is essentially, you guys have neurotransmitters all through your body, right? So the way nerve agents works is essentially as your body's firing, they sit in those pockets and prevent them from being able to send those signals, which in turn causes fibrillations, and your nerves aren't able to communicate properly because they're blocking those transmitters. Onset of symptoms, so it's odorless, colorless liquids or vapors. Onset symptoms within seconds or up to 18 hours. Meiosis, rhinorrhea, difficulty breathing, loss of consciousness, convulsions, flaccid paralysis, secretion from the mouth, lungs, sweating, nausea, vomiting, weakness. Treatment, atropine, 2-planar chloride, diazepam. So your Mark 1 kit will be replaced by autoinjector treatment nerve agent Atna, which will be a 1 injector with 2 chambers of atropine and 2-planar chloride. So this is administered IM and thigh or buttocks up to 3 times in 15-minute intervals. If symptoms continue, administer atropine injections at 5 to 10 minute intervals until symptoms subside. So max dose 3, then in 15-minute intervals. If symptoms continue, administer atropine injections at 5 to 10 minute intervals until symptoms subside.
I have a question.
Yes.
So the Mark 1 kit for diazepam, is that the same as like Canna thing that we were talking about? For diazepam?
Yeah. So Canna is for diazepam, and then your Atna is for your atropine.
So it's the same as the Mark 1 kit?
Yes.
And again,
So the diazepam is the Mark 1.
the terminology is going to throw you off on the test. Just know with diazepam, those 2 terms are associated with it depending on what they put on the test.
Blister agents or vesicants. So these are your mustard gases. They exert primary action to skin. So as soon as they come in contact with your skin, they're oily, colorless, or pale yellow. Leukocyte is dark brown or light to dark brown. Smells similar to geraniums. Symptoms: pain in gritty filling eyes, photophobia, erythema, blisters, typically within 12 to 48 hours. No specific treatment. British anti-leukocyte, use for leukocyte and wash away, or use your M91 kit. M291 kit.
Speaking of that, I got your answer since we're on that slide. So I'm going to go over the specific verbiage here because this is actually what's on the test also. All right? So for your M291 kit, it has 6 individual decon packets enough to perform 3 complete skin decontaminations, right? That's your M291. Okay? Now your other one is your M295 kit. And each kit contains enough to decontaminate 2 complete individual equipment operations. And it has the same kind of substance in there, but it's in a bigger packet, right? So the bigger concentration you can't use on the skin, and then you have it just for the heavy duty kind of equipment and supplies. So 6 packets for the 291, and then this one has enough for 295, enough to do 2 individual equipment operations. Sorry to interrupt there, Chief.
No. Alright, so blood agents disrupt oxygen utilization at cellular level, causing cellular suffocation. So hydrocyanide has bitter almond smell. All evaporate quickly into vapour gases. Increased rate of breathing, dizziness, nausea, vomiting, headache, eye irritation with rapid onset progressing to increased rate, depth of breathing convulsions, apnea, cardiac arrest. Treatment, so 2-amyl nitrate ampules, crushed and inhaled, or IV sodium nitrate 300 to 600 milligrams, then IV sodium thiosulfate, 12 to 5 grams, followed up with 2 antidotes at half dose as needed. So everyone understands that. Try to titrate up with those doses. So if they started at the 300 or 600, then you'll go down half 600. Same thing with sodium thiosulfate. So pulmonary agents damage membranes in the lungs and separate the alveolar tissue, resulting in fluid in the lungs. So essentially causing you to drown on your own fluids. So it includes phosphine, chlorine, HC smoke, and ammonia. Vapor form, chlorine and ammonia distinctly smell. Phosphine is colorless, it smells like fresh cut grass or hay. Symptoms: irritation of eyes, nose, airway, coughing, difficulty breathing, hoarseness, wheezing, tightness in chest. Those symptoms 2 to 6 hours post exposure. So essentially, once you kind of remove from that environment, symptoms subside. No antidote. Treatment is to remove patient from exposure, decon with fresh air, remove clothing, and rinse for liquids.
So an easy way to remember this stuff, if it helps you guys out, I think of pulmonary dealing with my lungs and dealing with the respiratory system, and most of the time allergies affect the respiratory system and kind of have very similar symptoms to it. And some people are allergic to seasonal allergies, which would be the smells of newly mown grass or hay. That's going to make them have kind of a breakout on that scenario. So I don't know if that helps, but I associate it that way from knowing the smells.
So riot control harassment agents, it's your CS gas, CRCN, the OC spray. So relatively non-toxic, produce immediate but temporary effects, crystallize solids disperse as fine particles or solutions, lacrimators, tear gases, vomiting agents. Symptoms: pain, burning, irritation to exposed skin, mucous membranes, redness of skin, short breath, increased tears, nasal secretions last up to 2 hours. Non-protective mask, moves fresh air, flush eyes, and skin with water.
Is there a smell associated with that? Or?
I've never heard of smells for riot
Not-
control.
Not that I know of. Has anyone done any type of OC spray, pepper spray for like, maybe if you were doing like sentry duty or you need to get your, what's it called? Is it 2 Bravo qualification when you stand and watch on the ship?
Surf Bravo.
Surf Bravo. When you go through, get the OC spray, or anyone ever done the decon chamber, so whoever did go through the camp, like with the Marines, when you go through doing that thing. So fun stuff. Pretty much once you get out of that space, everything clears up. You know, you're crying, tears, snot, whatever. Once you kind of get out and air out a little bit, all those symptoms subside. They still have some minor irritation. Skin with pepper spray, see that shit burns. It doesn't feel good at all, but yes.
My question is, I once saw a question on the events exam along the lines of like, what would you use for, like, to control a riot or something? Would it be like still, or?
Yes. Any other questions? Alright, so treatment of casualties. So first things first, you want to control the bleeding. So control hemorrhage, treat shot wounds, decon exposed eyes, skin, remove contaminated clothing, decontamination organization. So sentry, have your contaminated wound in one area. As they go through there, they'll get decon and then moved into clean to the treatment area, evacuation point, and then emergency. So they'll come in, be a sentry, go to the contamination, or get contaminated where they are, get decontaminated, and then process through. So each ship has 2 decon stations, which is there typically fore and aft, depending on your weather decks and how the ship's set up. On the Montour class ship, the newer Zumwalt class ships, there are 2 decon stations, and they're not necessarily on top of each other, but you have one on the deck where your boats come in. So you have your boat bay where the boats come in at. So you have one there. Then you also have one in kind of like the main corridor or main P-way when you come in through the wheel hangar. So it's to transition you through to medical. So biological warfare agents used throughout history. So types, bacteria, virus, toxins. Examples are so bacteria, plague, anthrax, tularemia. virus, smallpox, and hemorrhagic fevers, and you guys have the details on those already, correct?
I would come up with some sort of acronym or something to help remember. Usually they use the word TAP to remember the bacteria, so tularemia, anthrax, and plague. And then you just got your smallpox and hemorrhagic fevers. Again, easy to remember it as virus is something that has to attach to a host to survive. So both of those are type of diseases that have to attach to an individual for it to actually flourish.
So with disease outbreak, it's difficult to determine if it was natural or intentional. Indicators include unusual disease for area, restricted geographic distribution, absence of component natural vector, and then high morbidity rate. Detected by handheld assay panels, detects present in 15 minutes, portable labs, results within an hour. So PPE, your protective equipment, along with your gas mask. So symptoms, you guys went over all these already, correct? Do I need to go over them again? Play, you guys cover this. Bacteremia, botulinum toxin, ricin, you got smallpox. It's bad. Hemorrhagic fevers. Alright, so this is a diagram. So Bacillus anthracis or anthrax. What is that? Well, I just said it. Yersinia. Francilla. Alright. Botulinum. No known antidote. Variola, major and minor. So biological or radiological warfare. So history, World War II was the first atomic bomb. Radioactive dispersion device is any device that causes the purposeful dissemination of radioactive materials across an area without detonation. So a dirty bomb. Two modes: direct, where radiation may directly hit a sensitive atom or molecule in a cell; indirect, where radiation interacts with water molecules in the body. So particle rays, alpha, beta, gamma, and the neutrons. Alpha emitted through nucleus of radioactive elements. Heavy, short range, not able to penetrate clothing or skin. Beta, an injected electron, short range, light particle, moderately penetrating, penetrate skin to the germinal layer where skin cells are produced. Gamma and X-rays, electromagnetic waves, highly penetrating. And then neutrons, part of the nucleus emitted only during nuclear fusion or detonation. High penetrating radiation, no fallout hazard, 20 times greater damage than X-rays. So units of radiation absorbed dose, so RAS is used to measure quantity of radiation absorbed dose. International System units, new terminology is the gray dose is the total amount of energy absorbed per gram of tissue, see table. REM, unit used to derive the quantity of dose. And SI, unit of any quantities expressed in dose equivalent. So lethal human dose, 400 to 500 grams. So measurement devices, used to perform, so ANVDR2, used to perform ground surveys in vehicles or dismounted. Handheld provides measure to assist with decon. UDR is compact handheld device, or pocket held device, measures gamma neutron doses. PDQ1, multi-range device that detects beta gamma radiation using Geiger-Muller ionization chamber, has two ranges. Our exposure factors: time, distance, shielding, personal protective mask, T-bag anti-C suits, Mach 4, effects on personnel. So these are levels from the time of onset, from that initial exposure. So you see this table? So acute radiation syndrome, these are signs, symptoms, nausea, vomiting, diarrhea, malaise. You're going into phase 2, be feeling healthy, then sick again. Seizures, coma, then phase 3, convulsions, ataxia, tumor, lethargy, severe diarrhea, electrolyte disturbance, decreased white blood cells. Treatment, stabilize, decon, support care. So essentially, you're treating the symptoms at that point. Chronic radiation syndrome, long-term exposure to low-dose radiation, symptoms, sleep, appetite disturbance, weakness, fatigue. Treatment, removed from the environment. So dermatitis, acute chronic, prevented by washing off contaminated material. Symptoms, redness, irritation at area, hair loss, edema, sweating. And treatment, removed from radioactive source, radiation source. And that is all I have. Questions, comments, concerns?
Is it regarding these things that we see the gram negative, gram positive on the test? I know I've seen it a couple times, but I don't know if it's like regarding these or like something else.
So being so it is in lab, and it's not on your bibs, but usually when you have the Armed Forces case definitions, it'll talk about which organisms are gram positive and gram negative. That's usually what it'll come into play. So you guys really don't have that much on this bibs, besides the ones that are going to be mentioned in chapter 19 of the Corpsman Manual. Not 19, sorry. Yeah, it is 19. Yeah. So lab chapter in the Corpsman Manual.
I know I saw on the presentation back when it was still in about what percent separations is on a gram stain. That's like what I most remember. It'll be like staph aureus, which is a gram positive bacteria. Those are the biggest bacteria I ever saw in my life.
Violet.
Alright, that is all I have for you. If there are no questions, comments, concerns for me, thank you again for having me. I appreciate it. I love coming out and doing this stuff. I'll have a super great day.
Sorry, I'm going to show you guys right now because it was on that slide. I'll pull it up for you real quick.
I was wondering if that was the last one for me.
Yeah, that was the last one for you too.
Sweet. Thank you. You all have a great day.
Should we start here? So it was on this PowerPoint. Gram positive for anthrax. And I was going to tell you that, and we were going through all the slides. Pay attention to which ones are gram positive. If it helps you, make a group chart there so that we know, because they do throw that on the test about what you're using for what kind of organism it is or what you're using to treat that type of organism. So this one's gram positive. This one's gram negative for plague. And again, talk about when I was talking about this, the antibiotics are different with these. So you have strepto and centomycin is the particular one here for plague. Okay. Gram negative for tularemia. And then gentamicin is the one that stands out there for tularemia.
And with tularemia, pay attention to the cocobacillus because that's a completely different kind of shape than a rod or a cocci. So it looks a little different on a gram stain.
And I know I mentioned before, I don't know if I ever emphasized, be paying attention to these incubation periods. A lot of them are the same, but know how to differentiate them because they will ask what those specific incubation periods are on these diseases. As a lab tech, if somebody wants to, because I know I can explain it, I would like you to explain what incubation period means for these. Do you know?
Incubation period, that's in the human for our, is it? But incubation period in the lab is typically plates, like if you're talking about on an
And a human, right? So that's incubation period is how long they will be holding that disease within their body is the incubation period.
Before it starts giving symptoms.
Yeah.
Correct. Before it starts giving symptoms. So that is what is meaning there because that's why it's on the test. We want to know how many days this is going to be hanging around the body before we start seeing symptoms of these types of diseases. Botulism, gram positive. Okay. And then the only time I've seen it here, so these ones that end in valent, is no one going to be talking about botulism.
And anaerobic just means we incubate it with carbon dioxide.
Yep.
So they're, yeah, like lack of oxygen.
You know these little names right here too, because I like to ask those. That's one, like I said, lab is like pharmacy, and the agents are like pharmacy, where they like to use that scientific name over here on the side and throw that on the test. Ricin. Okay, because I know you kind of went quick through some of these. Beans of a castor plant, that's what you need to put a star next to for ricin.
Is it positive or negative?
Yeah, no, ricin's a toxin. Toxin.
The granting is for bacterial identification.
He's talking about
I think you just going over the slides he skipped.
Yep. No known antidote. So another one that stands out. I think there's one other one that was a no known antidote that you guys went over earlier today. I forgot which disease it was, but there's very few that have no known. And again here, why it was so deadly. If you see here, symptoms appear in 18 to 24 hours when inhaled, and death in days. Smallpox. Again, that was the one we hit on. Smallpox was another one. So no vaccine for prophylaxis. And then isolation recommended. Variola major and minor. Now these, because I've seen these on the test, on these freaking names right here, right? They like to use the word flavivirus. Alright? Just know when flavivirus is talking about mosquito or tick bite, right? Mosquitoes are going to give you yellow fever. So which mosquito did you learn about yesterday that would give you yellow fever? What was the little tip he gave you? Huh? Aegis aegypti, right? To make it make sense, Egypt, pyramids look yellow. Aedes aegypti, yellow fever. Right? Filoviruses are for Ebola. I've only really seen philo or flav on the test, but again, characterized by fever and bleeding. And then I think he said he was going to be back. I want to wait till HM1 Nally gets back here for you guys to break. But what I wanted to show you, I want you to pay attention to the incubation periods when I hit these slides here. So anthrax 1 to 7, plague 1 to 7. So those two are 1 to 7. Tularemia is 1 to 14. And then botulism is 12 to 36. And then this one is 18 to 24 hours. Okay. And then 7 to 19 for smallpox. So 1 to 7 for those first two. So anthrax and plague are 1 to 7.
How was your day?
Days. Okay, and then tularemia was 1 to 14 days. And then your hours ones is going to be your botulism, which is 12 to 36. And then ricin was 18 to 24 hours. And then we go back to days for smallpox being 7 to 19. And of course, there's no incubation periods for the fevers. All right. So I don't know if that helps y'all out, but at least grouping those together. I've seen incubation periods on the test before. Let me look at the schedule real quick. Oh, we have one more lesson. Okay. So the next lesson's at 11:10. So if you want to take a break right now, and then we have H1 Martinez back here. They'll be going over the malaria guide.